Hi, my name is Ramnik Mathur. I'm a consultant in NHS in the UK. Today I'm talking about a very important topic, which is sudden cardiac deaths in young people. So I'm sure you are aware, you must have heard of someone in your family or friend circle who suddenly collapsed and died or was found dead in the morning in their house. And that has happened to people who are fit, who appear fit, who are slim, who have an active lifestyle. They play some games regularly. And I know of a case of a doctor who played badminton and then suddenly died, and they found a clot in his coronary arteries. So I actually keep telling my friends to get this done, and I want to spread this information for everybody's benefit. That I know your cholesterol may be high and you might be taking some medicine, but it's not only the cholesterol which is responsible for coronary atherosclerosis. And what that means is the thickening of the vessel, the interior of the vessel, which is mainly responsible for what we call heart attack or myocardial ischemia. So even if your cholesterol is normal, your vessels might be occluded and your blood supply to your heart muscle may be compromised, leading to myocardial ischemia. And if it's a severe one, or if it happens again and again, then cardiac death is quite common. So the only way, not the only way, but the best way to find out if your vessels are in good shape is by getting what we call a CT angiogram. So what they do is basically they put a dye in your vein, and then they take a quick x-ray of your heart and they look at the coronary vessels, and they are able to tell if they are occluded. The other possibility is a cardiac catheterization, but they have to insert a catheter from your groin into your heart, which is an invasive procedure. But just get a CT angiogram, or if you can afford, get an MRI angiogram, because that does not involve any radiation. But CT angiogram is good enough, although it's a bit of radiation. If I think the benefit is much more than the risk of a bit of radiation. So if you find something, if you're in your 40s or 50s, or if you have a slightly higher BMI, or if you are eating a typical Indian diet like all of us do, with a lot of fat, a lot of fried stuff, just get a CT angiogram done. I know people will say, oh, it's radiation, you'll be okay, your cholesterol is fine. Just don't listen to them. Just get a CT angiogram, or if you can afford, get an MRI angiogram. I'm sure if you're watching this on a smartphone, you can afford one of those. So you might already be taking statin. That's the other thing. If you are sort of 40, 45, Indian, especially male, just start something like atorvastatin or simvastatin. So I take atorvastatin 20 milligrams every night. There is a scare about that it causes myopathy, so muscle pain, and that's been debunked now. It's very rare side effect. So just start taking once a day. Doesn't matter what your cholesterol is, and it might help you in some other conditions as well. It might help you prevent Alzheimer's, because the same vessels are there in your brain as well. So if you are getting vascular dementia, if you are taking something like atorvastatin, it might help prevent vascular dementia in later age. So there is no harm. Again, maybe speak to a doctor and think about getting a CT angiogram or MRI angiogram as soon as possible, and start taking some statins. Thank you.